We look forward to meeting you for your consultation. It's important you view this presentation before you attend. It will help you understand your options and their implications and will enable you to get the most from your consultation. The presentation lasts for about 15 minutes in total and covers the gastric band, gastric sleeve, gastric bypass and gastric balloon procedures. We ask that you view the complete presentation. This slide gives a brief overview of the 4 main procedures available in the UK today. We go into detail about each in the coming slides. The gastric band is a good option for most people we see. If you have a BMI between 30 and 45, you're in good health, and your primary motivation for surgery is to get your weight under control, as opposed to fixing specific health problems, then the band is a good option. It's a lower risk procedure than the other surgical options, and the recovery time is shorter. Most studies show that patients lose 50 to 60% of their excess weight over 2 years, and most of that weight is sustained long term. This is based on our own recently published data. In fact, Healthier Weight is the only private provider to publish its outcomes in peer-reviewed medical journals. This gives you confidence in our outcomes and methods. The band is adjustable. It is adjusted by injecting saline, salt water, into it at clinic visits. You should expect your band to be adjusted no more than 4 to 6 times over a 2-year period. A period of time, usually 2 to 3 months between adjustments, is needed to develop the diet habits to be successful. Your success with the band needs you to make changes to your diet and eating habits. The band should be viewed as a tool that you need to work with. It can help you feel fuller on a smaller portion, but only when you are following the right dietary habits. Eating foods of the right texture, slowly, and in small portions will be the key to long-term success in terms of your weight loss and reducing the risk of complications. Moving to gastric sleeve, this is a more invasive procedure than the band that involves permanently removing over 80% of the stomach. It's a powerful procedure that offers rapid weight loss. Patients often choose a sleeve because they are concerned about being able to work with the gastric band diet and eating regime, or they don't want the higher maintenance of gastric band adjustment appointments. If you are looking for something more powerful that will suppress the appetite, the sleeve is a good option, but it has a higher risk profile than the gastric band. The gastric bypass is an established and effective procedure that restricts the stomach's capacity and changes the balance of gut hormones to suppress your appetite. If you are having a procedure to deal with weight-related health issues as well as weight loss, the gastric bypass is often the best option, particularly if you are dealing with type 2 diabetes. Weight loss is comparable to the sleeve. Bypass patients will need long-term vitamin and mineral supplementation, and we'll talk more about that in the presentation. Turning to the gastric balloon, it's a non-surgical procedure where a balloon filled with harmless saline is placed in the stomach for 6 or 12 months before being removed. It's your choice whether you have the 6 or 12-month option. The balloon is a temporary solution and is generally aimed at those with a body mass index or BMI between 27 and 35. It's a safe procedure, delivering short-term weight loss of 2 to 3 stones for most people, but many will regain this weight when the balloon is removed. If you have a BMI above 30 and you're looking for a long-term solution, one of the surgical options would normally offer a better chance of sustained weight loss. There are pros and cons for all of the procedures that need to be considered in each individual case. In the end, you will need to decide, with our and your surgeon's input, how much you are prepared to commit to a change in eating and dieting habits in order to reach your goal weight. None of these procedures should be taken lightly and should only be considered when you're satisfied that you've exhausted all of the diet options at your disposal. If you have, and if your weight is having a negative impact on your day-to-day life, then they are a good option and can be life-changing. They offer excellent weight loss and health benefits, but they are not free from risk. We make great efforts to reduce and eradicate risk, but it's impossible to do so completely. It's for this reason we advise patients that you should only opt for surgery when you have reached that time when you are ready to make a commitment to a permanent change to your eating habits and when the potential weight loss rewards outweigh the risks. In the slides ahead, we show weight loss results and health benefits. These results are based on the published data available, and we have provided the references in the presentation. It's impossible to predict outcomes for individual patients before they go ahead. Some will do better than indicated, and others less so. Before coming to your consultation, please prepare a list of questions you want to cover with the surgeon, and remember to bring your prescription if you have one. Your surgeon will decide on your eligibility for surgery and the options available to you. It's really important you make full and honest disclosure of your medical history to the surgeon so we can make sure we recommend the correct procedures. Let me now go into more detail about the different procedures. NICE stands for the National Institute for Health and Clinical Excellence. NICE sets eligibility criteria that is followed for public sector healthcare, for example in the NHS. This applies to all treatments including weight loss surgery. Unlike private surgery, NICE has to balance the public health benefit of treatment with the cost to the public purse. In the private sector, we don't have the same restriction as the patient is paying. It means that we can select patients based on the best available published data. As a guide, that means we'll do gastric bands from BMI of 30 and gastric sleeve and gastric bypass from 35. Ultimately, decisions will depend on individual patient circumstances, and your surgeon will take the final decision on eligibility. If you have any queries about NICE guidance, please ask your surgeon at consultation or call us in advance. Now we focus on the gastric band. Jackie had a gastric band and lost 6 stone. The gastric band procedure is an established, safe and effective procedure, and for most healthier weight patients it represents the best weight loss surgery option. It's a safe procedure, safer than the other surgical options, and patients generally lose 50 to 60% of their excess weight, some more, some less. It's quick, and most patients can now have their band procedure performed as a day case, so you would go into hospital in the morning and be back home on the same afternoon or early evening. It's a reversible procedure that does not involve any cutting of the stomach, and this is why it's safer. It works by reducing the amount of food you eat before you feel full. The band is adjustable, so we're able to tighten or loosen it around the stomach so you can achieve consistent, steady weight loss when following the right dietary habits. There are many health benefits that you can expect with the gastric band, and the list is self-explanatory. The important thing to note about the band is that the health improvements go hand in hand with the weight loss. With the sleeve and bypass procedures, some of the health benefits are felt immediately as a result of the changes in gut hormones, but that's not the case with the band. The gastric band works in a very clever way. We place the band around the stomach to create a smaller stomach above the band, with the larger part of the stomach below. The food that's eaten goes into the smaller stomach, which we call the pouch. The food in the pouch then passes through the gap in the center of the band, called the stoma, into the larger stomach. When foods of the right texture are eaten at the right pace, we'll come on to the golden rules for success with the gastric band shortly, you should feel fuller on a smaller portion. So the golden rules. There are 3 that you need to follow for band success. Firstly, it's important to eat morsels, not mouthfuls, slowly. Also, you need to think about the texture of the foods you eat. Generally speaking, you need to eat foods that will not simply slip through the stoma. So it's important to avoid fatty, sugary, soft foods and liquids, because these slip through the band into the bigger stomach below the band, and the band does nothing for you. Eating the right foods slowly is critical to being successful with your band. We give you lots of advice and tips on diet before you have surgery and in the clinics afterwards. The animation here shows you how the band is placed. You'll see small incisions are made in the abdomen through which the instruments we need to use are positioned. The animation showed a 5-incision procedure, so 5 small horizontal scars could be expected. Some surgeons will do a 3, 4, or even 5-incision band procedure. As the scars are small, the cosmetic difference is minimal, and the procedure chosen by your surgeon will make no difference to your weight loss. Your surgeon at consultation will explain the technique that they use. Unfortunately, all surgery comes with a degree of risk, and it's impossible to remove this altogether. We have listed here the general complications associated with surgery that you should consider. At consultation, we'll talk in more detail about these and their possible relevance for you personally. It's a long list, but please don't be alarmed. For the sake of completeness, we've included all of the recognised complications, but the incidence rates are very low. This slide shows the complications that are specific to the gastric band. We have also shown typical incidence rates based on the published data, as well as our own outcomes. Our outcomes have been published and stand in comparison to the best centres in the world. We've warned here about the implications of a tight band. Sometimes patients are tempted to think a tight band means more weight loss, but that isn't the case. In fact, it's a bad thing. The band will only work when the right dietary behaviours are followed. An over-tight band can encourage the wrong behaviours. We offer a comprehensive warranty to protect you from additional surgery costs if you experience one of a number of the more common complications. Our standard warranty applies for 2 years, and you can choose to extend that to 5 years when you pay an additional fee. It's the most comprehensive warranty available, and it also protects you in the event of insolvency. You won't have to choose until closer to your surgery date whether you want the extended warranty or not. It's no exaggeration to say that your weight loss with the band will only be as good as the aftercare you receive. We're specialists in bands and have over 15 years' experience of supporting band patients. You'll get to know our support team well in the years ahead. They will adjust your band as necessary and give you the hints, tips and support you need for success. You have a 2-year package that includes free of charge band adjustments for those 2 years. We regard you as a patient for life, and we expect to be hearing from you and supporting you for the long term. This chart shows how we adjust your band. We want to tighten it just enough that you feel full on a small portion when eating the right foods. So we want to get you into the green zone, and there you can expect to lose weight steadily. We won't over-tighten the band because if you are in the red zone, it can lead to longer-term problems. In general, if you are vomiting with a band, it's because you are eating too quickly or your band is too tight, or both. It's wrong to think band patients vomit their way to weight loss. We sometimes hear this from inquirers who read about it online, but it's not the norm. It's important to stress that from time to time our nurse will refuse a band fill. This is when the dietary regime isn't being followed, weight loss is too slow or not happening, or there is a risk of the band being too tight if it's adjusted again. We want you to follow a low-calorie diet for 5 days, sometimes longer if you have a higher body mass index. This helps to kickstart your weight loss and also to make your liver a little more flexible. This is helpful because the surgeon has to move the liver to place the band. Before your procedure, it's really important that you give us an accurate list of any prescription medication you are taking and the dosage. If you are taking any medication, please take it to your consultation or bring an up-to-date list with you. After your surgery, it's very important you stick to the post-op diet. This enables the band to settle in its position. When you follow the post-op diet, you reduce the risk of a complication and set the foundations for long-term success. You'll also lose weight ahead of your first band adjustment review appointment, which is usually 5 weeks after your surgery. You should aim to lose at least 5% of your preoperative weight in the first 5 weeks after your surgery. We've covered most of these points before. Back to the golden rules. Eat foods of the right texture, slowly, and avoid high-calorie soft foods and liquids that slip straight through the pouch. Being active is also important, and we encourage you to try and spend more time on your feet every day, including at least 60 minutes walking. So, hopefully we've told you some things about the band you didn't know. It's a great procedure, and it's the safest surgical option for a healthy weight for most people. The weight loss is a little slower in the first couple of years than with a sleeve or bypass, but when we look ahead 5 to 10 years, there is little to choose between them in terms of weight loss. Here you can see some of our success stories. Please call if you have any questions. The sleeve gastrectomy, more commonly known as the gastric sleeve, is the fastest growing weight loss surgery procedure in the world. At Healthier Weight, we've been doing sleeves for over 10 years. Hallie was one of our sleeve patients who was successful, and she managed to completely change her life. You can read more about Hallie on our website. The sleeve is a more invasive and more powerful procedure than the gastric band, but it brings more risk too. It's a good option if you want something more powerful than a band. Perhaps you have a high starting BMI, or you want something that requires less maintenance than the band in the long term. Often patients will need to choose between the band and the sleeve. This presentation and your consultation will help you come to the right decision for you. On the slide we have listed the benefits of the sleeve. It's a good, low-maintenance procedure that offers excellent weight loss and health improvement. The slide shows the considerable health benefits you can expect from sleeve. These benefits are based on published data. One of the beauties of the sleeve is that the concept is simple. We cut and staple along the length of the stomach and remove over 80%, leaving you with a banana-shaped stomach. In addition to reducing the capacity of the stomach, the procedure also changes the balance of gut hormones and so reduces appetite. On this slide, we have listed the complications associated with a sleeve. We've given a long and comprehensive list. The incidence rates for these complications are very low, and we'll talk to you about them at consultation. Probably the main complication we try and eradicate is that of staple line leakage. If you experience this, it can lead to an extended stay in hospital and a possible transfer to the NHS to continue your treatment. About 1 in 80 to 100 patients will experience a staple line leak. In these circumstances, most surgeons would consider that the safest place to continue your treatment would be within an NHS hospital. A side effect of sleeve is that a proportion of patients will develop reflux symptoms. This has to be taken into account, and we'll discuss this at your consultation. If you have reflux already, please disclose this to the surgeon, as it's unlikely we would consider a sleeve in these circumstances. We want you to follow a low-calorie diet for 5 days, sometimes longer if you have a higher body mass index. This helps to kickstart your weight loss and also to make your liver a little more flexible. This is helpful because the surgeon has to move the liver to do the sleeve. Before your procedure, it's really important that you give us an accurate list of any prescription medication you are taking and the dosage. Please take your prescription with you to your consultation. After your surgery, it's important that you stick to the post-op diet. This enables the stomach and bowel to heal and prevents retching and vomiting. If you follow the post-op diet, you will reduce the risk of a complication and set the foundation for long-term success. You will need to take a medication called a PPI, usually named omeprazole, for 3 months after surgery to protect the lining of your stomach. Long term, you can eat normal foods, but your portions will be very small. You should avoid fatty and sugary foods and be careful with the number of calories in the drinks and soft foods you eat. Our team is here to help you, and our expertise in long-term aftercare is one of the things you are investing in when you choose to have your procedure with Healthier Weight. We have listed here the regular reviews you can expect and the different types of support we offer. Most importantly, we and our team of surgeons are always here to help you as and when needed, whether that is in 1 day, 1 year, or 10 years after your surgery. We're here to help you be successful with your sleeve for the long term. There are a number of important and unique components to our package that it's important that you understand, and our team will explain these to you before you go ahead. We have also developed a range of finance plans to help make the procedure more accessible. We hope these notes have been helpful. Please call if you have any queries, otherwise we look forward to seeing you at consultation. We look forward to meeting you shortly. The gastric bypass is a great procedure that offers life-changing results for patients. It's especially good for patients who are experiencing health problems such as type 2 diabetes. The bypass is a well-established procedure. It offers excellent weight loss and health benefits. It's a good option for people with a body mass index over 35, especially for those who are managing health issues associated with their weight. The bypass will usually deliver in the region of 60 to 70% excess weight loss over 2 years. It works by reducing substantially the size of the stomach into which the food you eat goes. It also brings about a change in gut hormones that both suppresses appetite and can bring about immediate health benefits. Bypass patients can also expect an increase in life expectancy, so it really offers life-changing benefits. Here are some of the specific health benefits. If you are living with type 2 diabetes and/or reflux, a bypass is usually considered the best procedure for you. With the bypass, we reduce the size of the stomach and so reduce its capacity. We also cut the bowel so the food enters the bowel further along. You can see this in the diagram and the animation on the next slide. The effect of these changes is to reduce stomach capacity and to change the balance of gut hormones so as to reduce appetite. After a bypass, you will need to take vitamin and mineral supplementation for the rest of your life. This will include B12 injections or tablets. All surgery brings a level of risk and unpredictability. This is unavoidable and has to be weighed against the benefits. We have listed all of the recognized complications of bypass on this page. It's a long list, but the incidence rates are very low. Your surgeon will explain the risks in more detail when you meet. We've also included some other considerations for you to take into account. The bypass is a powerful procedure and delivers good weight loss results, but in order to maintain the weight loss and health benefits, you need to accept and commit to the lifelong changed eating habits that is involved. On this slide, we highlight some of the other factors you need to consider when opting for bypass. There will be a need for lifelong vitamin and mineral supplementation, and we encourage regular blood tests, and we'll write to your GP to help with this. One of the side effects of bypass is dumping syndrome. You may have heard of this. Minor dumping symptoms are experienced by most patients, but they usually pass quite quickly and rarely need more than dietary modification. Your surgeon will talk to you about dumping. We want you to follow a low-calorie diet for 5 days, sometimes longer if you have a higher body mass index. This helps to kickstart your weight loss and also to make your liver a little more flexible. This is helpful because the surgeon has to move the liver to get to the stomach. Before your procedure, it's really important that you give us an accurate list of any prescription medication you are taking and the dosage. If you are taking any medication, please make sure your surgeon has an up-to-date list at your consultation. After your surgery, it's very important you stick to the post-op diet. This enables the stomach and bowel to heal and prevents retching and vomiting. When you follow the post-op diet, you reduce the risk of a complication and set the foundation for long-term success. Long-term, you can eat normal foods, but your portions will be smaller. You should avoid fatty and sugary foods and be careful with the number of calories in the drinks and soft foods you eat. Try and eat small portions slowly. You will need to take medication called a PPI, usually a Meprazole, for 3 months after your surgery to protect the lining of your stomach. Our team is here to help you, and our expertise in long-term aftercare is one of the things you are investing in when you choose to have your procedure with Healthier Weight. We have listed here the regular reviews you can expect and the different types of support we offer. Most importantly, we and our team of surgeons are always here to help you as and when needed, whether that is 1 day, 1 year, or 10 years after your surgery. We hope this has been helpful. Please call us if you have any questions, and please be sure to ask any questions of your surgeon when you meet at consultation. The balloon is an established weight loss procedure that can provide a kickstart to weight loss if you are looking to lose a few stone in weight. Tracy had a balloon and was very successful. The balloon is made of silicone and is filled with salt water. It is placed in the stomach empty and then filled, typically to about 600 millilitres. The fill volume varies depending on the size of the stomach. The balloon itself remains in the stomach for 6 or 12 months, depending on your choice of balloon. Once removed, there is a continuous support program for a further 6 months. Generally, the balloon is for those who are looking for a short-term solution to kickstart weight loss. It may also appeal to you if you are not yet ready to consider surgery. Balloon patients accept that weight loss results over the medium to long term are generally not as good as those with the surgical procedures. Most patients will regain weight after their balloon is removed. To avoid this, it is essential that you make permanent changes to your diet and exercise habits while the balloon is in that you can sustain when it is removed. It's impossible to accurately predict weight loss as results vary from patient to patient, but on average you could lose 2 to 3 stones over the period the balloon is in place, with most of that weight loss in the first few months. To get the maximum long-term benefit from the balloon, you need to commit to permanent changes to your diet and exercise regime. Here we have shown the experience of Danielle and Tracy, who did very well with their balloons. They were good balloon candidates and achieved great results that were life-changing. For both of them, the balloon was a kickstart to bigger eating and exercise changes that they wanted to make. Having the balloon put in requires a visit to the hospital that will last for just 3 to 4 hours in total. The procedure itself lasts no more than about 10 minutes, and you'll be heavily sedated for this. A couple of hours after the balloon is put in, you will normally be discharged. You'll also be given some take-home medication to help manage any sickness and nausea that you experience. The balloon is removed by an almost identical process to the one we used to place it. We will arrange the explantation date, and it's important that you keep this as the balloon needs to be removed after 6 or 12 months, depending on which one you've chosen. It is unsafe to leave the balloon in place for longer than it's licensed to be there. It is your responsibility to keep your balloon removal appointment or to let us know as soon as possible if you cannot attend. There is a simple dietary regime that requires you to have fluids only for 2 weeks after the balloon is put in and then 2 weeks of soft foods after that. It's important for you to take your PPI medication for the whole of the period that the balloon is in place, as this protects the wall of the stomach and reduces the risk of a stomach ulcer. We provide a support package to help you achieve long-term success. You'll be supported by our clinical team who will be in regular contact with you to ensure you have the help and advice you need for success. Making a permanent change to your diet and eating habits will be key to your long-term weight loss success, and we'll provide hints and tips to assist with this. You have a decision to make whether to elect for the 6-month bib balloon or the 12-month Orbera 365 balloon. Both are proven devices, have a CE mark, and are approved by the FDA in the United States. The benefit of the 12-month balloon is that weight loss is sustained for a longer period than it is for the 6-month balloon. This gives an extended period in which to make the long-term changes that are required for sustained weight loss. Unfortunately, some patients are unable to tolerate the balloon and will have it removed before the full implantation period is completed. About 1 in 20 patients will have the balloon removed earlier than was planned. The side effects and complications are listed here. The main one is some short-term sickness and nausea. This usually subsides after 3 or 4 days, and we will give you some take-home medication to help manage this. The other complications would be damage to the stomach or esophagus when the balloon is placed or removed, ulceration of the stomach, or balloon rupture. As with all procedures of any kind, there is an element of unpredictability, and we can give you more information on potential risks at your consultation. It is important that if you experience sickness for a period of more than 24 hours and it prevents you from drinking liquids, that you call us on our emergency number so that we can take steps to help you stay hydrated while the sickness symptoms pass. The balloon is a good procedure if you are looking for a non-surgical kickstart to your weight loss and want to lose 2 to 3 stones over a 6 to 12 month period. One of the main benefits is that the balloon is removed with no permanent change to the anatomy. This is unique to the balloon as a weight loss procedure. At Healthier Weight, we are specialists in weight loss surgery. We make a promise to our patients to deliver high-quality service, high-quality care, and to protect you through your journey. We will operate robust governance processes to ensure services are of a high standard and also that we work to those high standards. The commitment we make to our patients' success has enabled us to become a world-renowned centre. Thank you for watching this presentation. Please make a list of any questions you have and ask them at your consultation. We look forward to meeting you at consultation and to helping you along your weight loss journey. We hope this presentation has been useful. Please call if you have any questions. Otherwise, we'll look forward to seeing you at consultation.